My name is Heinz Löwis. I am a member of the Rehab team, and today I would like to talk to you about how I can put together a training group using the patient management. If we work with fixed training times, which means that the patients always appear at the same time, and if we also know the patients' names because we have a patient list or something similar, we should set the patient selection criteria to none. And then we follow the classic way by searching for the surname, which means search patient. Enter the first letter of the surname and then double-click on the patient. The whole process is repeated until the entire group has been assembled. By typing the button numbers, I place the patients in order. The therapist usually has enough time for this action since the patients meanwhile look for their training device and fix the guard.
Für diese Aktion hat der Therapeut normalerweise genügend Zeit, da die Patienten währenddessen ihr Trainingsgerät suchen und den Guard fixieren.
On the left, we put together the group of patients. On the right, the patient is placed. And at the same time, we see the ECG of the placed patients all the time. When we made a mistake in placing a patient, we can bring that patient back onto the list by clicking the red X and then correcting the placement accordingly. After the placement is complete, we select the Monitoring button, and this takes us directly to the training overview, where we can then start the training, for example, with a group start. If we do not have a patient list, and we can only identify the patients by calling them out, we set the patient selection criteria, for example, on last trained patients. We can then further restrict this group by using the Filter List By search function. There are two options here. We can search for the patients by entering letters, or we can search for the patients by entering numbers. Let's start searching by entering letters. For example, A. Then all surnames and first names containing the letter A are listed. By entering another letter, for example N, you can then narrow down this list further. The patient you are looking for is marked and placed on the corresponding training device by selecting the button number. The second option is to enter numbers, for example the number 6. Then all dates of birth are searched for the number 6. If you enter another number, for example 5, the list is further reduced. Here too, the marked patient is placed by selecting the button number. This process is repeated until the entire group has been assembled.
Bis man die komplette Gruppe zusammengestellt hat.